I'm really excited to tell you today about the work that I've been doing for the last couple of years. My name is Terry Myun, master student from Gachon University, and I'm going to explain how we can extract explainable clinical decision rules in Korean medicine using a method called symbolic regression. There are two important pillars in medicine, that is, efficacy and safety. When we build a medical AI, it should be not only accurate, but also explainable in order to obtain safety. For example, it doesn't matter if you don't know why Netflix recommended a movie. If you don't like it, you just don't watch it. But you must know the reason why a medical AI made a diagnosis in order to decide whether to accept it. Okay, then how can we make medical AI's judgments explainable? We try to achieve this goal by making explicit and interpretable formulas. We first attempted to create an example model that mimics a specific Korean medicine doctor's decision-making process. The domain of the example model is 사상의학. Specifically, it will mimic the process of diagnosing 소음인 patients into 4 disease patterns, 울강, 망양, 태음, 소음. The 31 symptoms of 소음인 patients presented in the CPG were used as features for model training. We utilize a synthetic patient generation to make training data for the model. This is how we made it. An SCM, 사상의학 expert, created an inter-feature correlation matrix based on his clinical experience. From this correlation matrix, we generated 100 synthetic patient cases, each with around 10 symptoms. The same SCM expert diagnosed these cases into 4 classes, providing ground truth labels. This is how we assess the performance of the models. The model would learn patterns from the 80 train set and then will predict the true label of the 20 test set. This process was repeated 5 times with different splits to get a fair result. And since this is a classification task, F1 score was used as assessment metric. Now comes the symbolic regression, SR in short, the main method of our study. SR automatically finds mathematical equations that best fit the data. With genetic algorithms such as mutation and crossover, it explores various equation structures and evolves them toward better solutions. Here are the interpretable, explicit, symbolic expressions that our model found. These equations map symptom features to one of the 4 diagnoses of 소음인 patients. For comparison, we tested 5 conventional models on the same train set. Model comparison covers 2 aspects: classification performance and explainability of predictions. First, we will look at the classification performance. This is the 5-fold CV results of all models. As you can see, except for the decision tree, all models predicted fairly well with no significant difference. But for the explainability, there are huge differences. As you can see here, SR gives clear and concise formulas with nonlinear terms that capture rich and complex relationships among symptoms. But logistic regression can only make simple linear combinations formulas. And for the conventional tree-based models, they can provide explanations only in terms of feature importance. That is, you can see which feature played an important role in classifying. They do not yield explicit equations for decision boundaries. This is less transparent than SR because in clinical settings, clear rules of diagnosis are important. So far, we've been showing that SR can be useful for multivariable classification in medical diagnosis. However, even with explicit formulas, it's not easy for humans to intuitively understand them. So we took a further step by integrating an LLM agent to create an agentic AI that makes SR-generated formulas more interpretable. These are the mock-up version of the agentic AI web app that can perform all the process I just explained to you. Here you can put the correlation coefficients between symptoms. Then the app will generate virtual patients based on this matrix. Then you can label the generated virtual patient cases And these label samples will be the train set for the SR model. Finally, here you can put the patient case that you want to know. Then the model will output the probabilities of each diagnosis. Also, with the help of LLM agent, you can find more intuitive explanations why the model made such decision, and further checklists to make sure the accurate outcome. In this patient case, the model suggested 15% of probabilities of 소음병 and 6% of probabilities of 태음병. And the reason of this diagnosis says that since there are no heat signs, 울광 and 망양 were excluded, and due to frequent impatience, 소음병 was more probable than 태음병. Additionally, agentic AI tells the user to check whether the patient has more symptoms like thirst with inability to drink or diarrhea when feeling unwell, because in those cases, probabilities of 소음병 will increase to 95%. In conclusion, let me talk about the practical implications of this approach. First, objective self-review. The system turns the doctor's decisions into clear equations. Doctors can then review their own decision patterns objectively. Secondly, school-specific AI. We can combine equations from multiple doctors in the same school. This will be the groundwork for developing school-specific CDSS AI. Thank you all for listening, and I'll be glad to take questions.